The new normal, it's been called. Let's continue to reflect on the past 2 years. We're joined by Malan. She is the editor-in-chief of Bhekisisa. Thank you very much, Mia, for joining us this afternoon. So how would you say South Africa has fared in its response?
I think that depends on who you ask, because we've certainly seen scientists or credible scientists who have different opinions. I think to answer that question, we do have to remember that at the beginning of our response, it happened against the background where there was no science to work with. We really, all we had was to work with what other countries who had cases before us were doing, and a lot of guessing was involved with that. So it was very hard to have, to know exactly what to do at this stage. But I think something that we can be proud of is that our governments did acknowledge science and follow science. There's certainly different opinions on, how that science was interpreted and acted on. But if we compare our response to countries, say, like Brazil or Tanzania, there was no denial that there was SARS-CoV-2, the virus that causes COVID. And there was also no denial of science around vaccines, for instance, that they worked pretty well. And we could be proud of our scientists, and also something that was very apparent for me that surprised me a lot was that when you go to a vaccination site, that a private site is not necessarily better than a public site. And that was, I haven't seen that often. It's generally the rule that the government, services wouldn't be as good as the private services. But I think what we can't be so proud of is that when you have something like a vaccine rollout, the one part of the response is to get the stuff that you need, so the vaccine's here so that people can use it. The other part is to get people to the places where they need to access this. Now, when it comes to communication and education around this from the government, this was not consistent. Sometimes it was very good. For instance, at the beginning of our pandemic, when Professor Abdul Karim was on the television and everyone understood what he said, but that was not consistent. It went up and down. And when you're not consistent in a pandemic, it doesn't build trust. And if people don't trust the provider of services, which was essentially the government in this case, then the uptake of services is lower. So we definitely saw that that is something that we need to work on, that consistent communication and education campaigns around why certain medical interventions need to be used certainly needs to improve.
You point out the example that there wasn't a difference really that you observed from a public or a private site in terms of this pandemic. We've always been said to be the most unequal society in the world. What do you believe COVID exposed about the country?
So, pandemics, there's nothing like a pandemic to tell you what society looks like. It is like a mirror. It reflects what is there, and it just makes it just makes what is worse even worse and what is good better. So if you look at COVID, what it told us about not just South Africa but the world is that while health should be a human right that anyone can access regardless of how much money they have, doesn't work that way. We live in an unequal society, and we know from research that the almost main driver of the spread of disease is inequity. And the reason why inequity drives it so much is because if you can't afford an intervention, say a vaccine or whatever the medicine is that you need, you can't treat that disease. And also, if you can't, in the case of, say, COVID, right at the beginning, afford the personal protective equipment, for instance, then you also can't prevent the spread or slow down the spread of the disease. So in this case, we definitely saw what South Africa looks like, and we know it's one of the most unequal societies in the world. And we know that the thing that we need to do ultimately to eradicate diseases in the world is to fix inequity. We can have all the interventions in the world, but if the people who need those interventions most can't afford it, then it's not of much use. And in the case of vaccines, for instance, where people in Africa were very vulnerable, and also in South Africa where poorer people were very vulnerable because of various comorbidities such as HIV and TB, they were the people who were least able to access it. Now, in the case of South Africa, the government certainly did make vaccines available at government sites and to everyone. But the thing is, you need money to get to those sites. So we see in research that's done that people who can, for instance, afford medical aids in South Africa are far more likely to get vaccinated than those who can't. And the reason is not because you have to pay for it, because the government made sure that everyone can access it for free if they can't pay. The thing is that people who can afford medical aids are more likely to have cars and transport and more money. So it's easier for them to get to sites. It's also easier to reach them because they can all access internet and social media. And, the information access is just easier. Where if you live in a rural area or if you live in say a township and you don't necessarily have money to buy data, you have to be reached in other ways. So if we don't address inequity in this world, we're not going to get far with eradicating diseases. And that involves things like also richer countries changing their attitudes, operating in different ways, but also pharmaceutical companies need to change their terms. They can't forever hold on to intellectual property rights, for instance, for medicines that everyone needs, but that poorer people can't access because they hold the patents. So our society, in essence, needs to change how we operate if we want to make sure that the next pandemic is better addressed.
Very quickly, just a quick story of how misinformation or disinformation drove home just this morning in the makeup room. One of the aunties came in very excitedly and said, I hear that on the 15th of April we'll no longer be wearing masks. So that being an issue for the past 2 years as well. Non-pharmaceutical measures as we look forward to the meeting of the NCCC and the presidency. Can we look forward to that being a thing of the past or not by a long shot?
Well, I think around the world we are now seeing many non-pharmaceutical measures being dropped because we need to learn how to live with COVID now. And I think in South Africa, the Ministerial Advisory Committee has made recommendations to the Health Department, who will in turn make them to the Coronavirus Council. I certainly get the feeling, I can't of course say for sure, but I get the feeling that there will be changes in my discussions that I've had with the Health Department. But we cannot drop everything because then the virus will just spread again. So the feeling I get is that things like outdoor masking may be dropped, social distancing, sanitizing, but that there still will be some measures to contain the virus indoors. So you need some restrictions on how many people can gather inside, whether you still need to wear masks inside. And the big thing, of course, which is very controversial, is will there be vaccine rules or mandates that restricts you from engaging in certain activities indoors specifically, because then the virus spreads quicker if you're not vaccinated. And that, I think, is something that we've seen controversial around the world, but it's worked pretty well in some circumstances where it did increase vaccination rates. But of course, there's lots of politics around it. And those measures together, the dropping or the easing of non-pharmaceutical measures, along with how are we going to get more people vaccinated, is what we need to see what will happen. And quickly, why do we need to see more people vaccinated or perhaps restrictions on who enters indoor settings? It's because there's lots of data that shows us that if you're vaccinated, you are less likely to transmit the virus to others, because the amount of virus that you have in your body is less and the time that you will have symptoms is also reduced. So there's a shorter time that you can transmit the virus.
Malan is the editor-in-chief of Bhekisisa Health. Thank you very much for joining us this afternoon.